of a second wave of COVID-19 infections, including by strengthening our healthcare preparedness and capabilities. B, extend the additional and temporary financial support to households most affected by the lockdown economic activities throughout the easing up phase. And C, ensure that all rules and guidelines are put in place in relation to the proposed phased resumption of economic activities after consultation with businesses, trade unions, and civil society.
Mr. Speaker, sir, it is with a sense of relief that I answer this private notice question, as facts and figures testify that our nation has till now successfully managed to weather the storm caused by the COVID-19 pandemic. As I announced in my statement to the House on 20th March 2020, the government has been acting with much foresight in the management of COVID-19 crisis and had already taken a number of preventive measures as from the 7th of January 2020. As the House is aware, as soon as the first case of COVID-19 was detected on 18th March 2020 in Mauritius, a sanitary confinement was imposed as from 20th of March 2020. A curfew order was issued on 22nd of March 2020, which was subsequently extended on 3 occasions as it was considered necessary and expedient for the purposes of preventing the spread of coronavirus and to protect the health of the population. Mr. Speaker, sir, a confinement is an important and powerful component of control of the outbreak of infectious diseases. The timely and effective implementation of this powerful measure as part of a comprehensive package of public health response and containment measures has contributed significantly to contain the spread of the disease in our country. As a matter of fact, for the last 8 consecutive days, there have been no new reported cases of COVID-19 in Mauritius. Moreover, we have presently only 3 active cases. Mr. Speaker, sir, imposing or lifting a lockdown are measures which are directly related to public health. Any decision in relation thereto should therefore be based on scientific evidence and guidelines. In regard to the government's strategy and action plan for easing some of the curfew restrictions which were announced on Friday last, I must say that it is a plan that has been carefully thought out, based on scientific advice, and is precisely geared towards preventing a resurgence of the epidemic. In fact, at its meeting held on 10th of April 2020, Cabinet agreed to the setting up of a National Steering Committee, under my chair, to develop a post-curfew strategy and an action plan for a phased resumption of economic and other activities. The committee was composed of several senior ministers and officials. In addition, 4 subcommittees were set up to make appropriate recommendations to the National Steering Committee. The government strategy and action plan hinges around one central concern, that is, the continued protection of public health, which remains its topmost priority. Government intends, by all means, to avoid the risk of a possible resurgence with a second wave of COVID-19 infection. Any such resurgence would not only jeopardize the gains achieved so far in terms of containment of the disease, but will also put a heavy strain on our health services and the economy in general.